Hi, I'm Joel Kaplan, and I'm presently a professor of anesthesiology in the department at the University of California in San Diego. This is the 6th edition of cardiac anesthesia, and the feature of this edition parallels the changes that are going on in anesthesia for cardiac surgery. We've moved towards, in the operating room, monitoring all the patients with transesophageal echocardiography. And the focus of this book is really to emphasize the role of echocardiography in the management of the cardiac patient during cardiac surgery. So every chapter has elements in it related to echocardiography. This is the first edition of the book that's been printed in full color with just beautiful photography, and it's also the first edition that's been online with videos. So this has become a major focus of the book. You can read about coronary artery surgery. You could then look at the pictures, the echocardiograms during surgery, and then you can go online and actually see the videos, and putting this all together becomes a very unique teaching environment. The other day I was in the operating room with a resident and a medical student, and we were doing an off-pump coronary bypass operation. And the medical student asked a question or two, and I referred him to the small version of the book, the Essentials book. And then the resident said, well, there's much more information in the new big book. So he pulled out the big book, and we looked at some of the color pictures, and the resident was talking all about the echo and the changes in wall motion that were going on during this case. And the student was having a little trouble visualizing this, so we have the computerized record keeper right in the operating room with the computer. And we went to the website and pulled up the echoes and went through a problem case that's on the echoes, and the medical student immediately could see the wall motion changes. So it really dramatized the change from just a black and white book to the color book that the 6th edition now is, to the video and how we can use that. And the other thing we've really added to this edition is that we're going to keep upgrading the book. One of the problems with books, in my experience, is they go out of date very quickly, and everybody talks about that. But now that I edit the journal, and in the journal every 2 months we're bringing out new cases, new echo material, the latest in cardiac anesthesia, we're now going to use summaries and pieces of that and use it as updates of the book. So as you go online, you're going to be able to keep up. And over the course of the next 5 years, the book will be a living book with additional material added all along. And then that'll be incorporated into the next edition as we go forward. So that's really an advance, quite an exciting advance from what we had previously. There's one other point that I think is worth mentioning with the new book, and that's, again, to emphasize how it ties in with the other educational materials that I've put together in this field. Because somebody who's going to practice anesthesia for cardiac surgery really has to be familiar with all levels of the material. And we have different people on the anesthesia care team. We might have nurse anesthetists working with us, or physician's assistants. We have residents. Then we have the advanced fellows, and finally the practitioners. So what we've done is we've taken the clinical material and put it in the smaller book called The Essentials of Cardiac Anesthesia, so that if you do this only occasionally, or as a junior member of the team, the Essentials book might have enough for you for the first couple of months of what you're doing. As you get more experience, or you become a resident or a fellow, or if you do this more often in private practice, you're going to want the big new 6th edition with all the information in there. And then to keep up, there's the Journal of Cardiothoracic and Vascular Anesthesia that I've been editing now for 25 years. And this comes out every 2 months and continues to give us the latest and newest information, particularly on the new drugs and the new monitors. So having what I call this threesome of the basic book, the more advanced book, and the journal gives the practitioner an opportunity to use the full depth of this material to continue to learn and to continue to use it to teach his colleagues.